Stroke. You have 3 hours to save your brain. Fast protocol. In any given moment, as you are absorbing this information, a person somewhere on Earth is permanently losing the ability to communicate. Within the next 60 seconds alone, several more individuals will experience a debilitating loss of control over half of their body, a devastating consequence that is almost invariably linked to a singular preventable cause: the failure to recognize the critical warning signs of a stroke in time. This profound impact was brought into stark relief when, a mere 2 weeks ago, a message arrived that continues to resonate deeply. A man recounted how his wife suffered a stroke directly before his eyes. In his confusion and concern, he mistook her symptoms for mere tiredness or dizziness, delaying the call to emergency services for an agonizing 2 hours. Tragically, this delay resulted in his wife's permanent reliance on a wheelchair. Those 2 hours, he realized with heartbreaking clarity, were the critical error, for when it comes to the health of our brain, the luxury of time is an illusion. We are not granted an extended period. Instead, we have a fleeting window of approximately 3 hours. Beyond this crucial time frame, the damage inflicted upon brain tissue becomes permanent and irreversible. However, a vital piece of knowledge that eludes many is the existence of a simple 10-second test that can be the decisive factor between someone regaining full mobility or facing a lifetime of impairment. This video aims to equip you with precisely that knowledge. Over the next few minutes, you will learn to identify the signs of a stroke in a mere 10 seconds by mastering 4 easily understandable indicators, so straightforward that even a child can grasp them. Furthermore, you will discover the precise actions to take within the initial 3 minutes of a suspected stroke to safeguard an entire brain. Most importantly, you will gain insight into proactive measures to significantly reduce your personal risk, thereby protecting yourself and your loved ones from ever facing such a devastating event. The stark reality is that an overwhelming 80% of all strokes are entirely preventable. If the ability to speak, to walk, to recognize the faces of your dearest family members tomorrow holds any value for you, then it is imperative that you continue watching this video. The information you are about to acquire possesses the power to save a life. My name is Dr. Charles Bennett, and I am here to articulate a truth that medical professionals often struggle to convey with the necessary urgency until it is tragically too late. A stroke, it must be understood, is an indiscriminate assailant. It pays no heed to your age, whether you are 30 or 70. It disregards your commitment to a healthy diet or your dedication to running marathons. The statistics paint a sobering picture. 1 in every 4 individuals watching this video will, at some point in their lives, experience a stroke. Consider this for a moment. Look around you, identify 4 people you cherish: a parent, a spouse, a friend, a sibling. According to the data, one of them is statistically destined to endure a stroke, and that person could very well be you. However, here lies the revolutionary secret that possesses the power to alter this grim prognosis. Your brain, remarkably, offers premonitions before a stroke occurs. It sends out signals, it pleads for assistance. The true tragedy is that the vast majority of people are simply unequipped to decipher these crucial distress calls. Envision your brain as a bustling city. The blood vessels that nourish it are the intricate network of roads. The oxygen and vital nutrients transported through these vessels are the essential traffic that sustains every function, every cell, keeping the entire metropolis alive and thriving. Now, imagine that one of these critical roadways suddenly becomes completely obstructed. The flow of oxygen ceases, the vital fuel is cut off. In such a scenario, the edifices of the city, the brain cells, begin to shut down one by one, and their demise is permanent. This, in essence, is a stroke, and for every single minute that passes in a state of delay, an estimated 2 million brain cells perish. 2 million. These are not cells that possess the ability to regenerate. There is no magical reset button, no opportunity for a second chance. It is akin to a precious book having pages irrevocably burned away. Once those pages are gone, the information they contained is lost to eternity. Those missing pages might have held the instructions for the coordinated movement of your right hand, the capacity to articulate the profound words, "I love you," or the vivid, cherished memories of your children's faces. Yet, there exists a treatment, a remarkable intervention, capable of reversing this destructive damage if administered within the critical time frame. This treatment is known as TPA, a clot-dissolving agent that restores blood flow and, crucially, salvages brain tissue. However, its efficacy is confined to a very narrow temporal window, typically ranging from 3 to 4 hours from the precise moment the first symptoms manifest. Beyond this period, irrespective of the sophistication of the hospital, the eminence of the physician, or the depth of your financial resources, it is simply too late to avert the permanent consequences. This is precisely why the immediate recognition of a stroke is of paramount importance, and this is the very reason why it is absolutely essential for you to internalize this knowledge right now. 4 letters, 10 seconds, and potentially 1 life saved. The FAST acronym was meticulously developed by emergency neurologists who, having witnessed countless patients arrive at medical facilities beyond the point of optimal intervention, posed a fundamental question: how can we simplify stroke recognition to such an extent that anyone, regardless of their medical background, can perform it effectively? The answer they arrived at was the easily memorable FAST protocol. The letter F stands for face. Observe the individual directly and ask them to smile. If one side of their face fails to move, if the smile appears lopsided, drooping, or asymmetrical, this is not a mere facial tic. It is a significant red flag indicative of a stroke. You might observe a noticeable sagging on one side of the mouth or an inability for one eye to close fully. This occurs because the stroke has interrupted the crucial communication pathway between the brain and the muscles controlling facial movements. The letter A represents arms. Instruct the person to raise both arms straight out in front of them as if they are presenting a tray. If one arm falters, drifts downwards uncontrollably, or is demonstrably incapable of being lifted, this is a strong indicator of a stroke. It is as if the brain has suddenly severed its connection to that particular limb. The arm is physically present, but the command signal is absent. The letter S denotes speech. Request that they repeat a simple sentence, such as, "The sky is blue," if their words are slurred, jumbled, incomplete, or nonsensical. This points towards a stroke. In many instances, the individual clearly comprehends what they wish to articulate, yet their mouth and tongue fail to cooperate, a profoundly terrifying experience for the person undergoing it, underscoring the critical need for calm and swift action. Finally, the letter T signifies time. If you observe even a single one of these warning signs, your immediate and unwavering response must be to contact emergency services without delay. Do not postpone the call by 5 minutes, nor wait to see if the symptoms subside. Do not offer them water. Do not administer aspirin. Do not attempt to transport them to the hospital yourself. Your sole imperative is to dial 911. The arrival of paramedics initiates immediate medical assessment and care, alerting the hospital in advance to prepare for a stroke patient and enabling direct transport to a specialized stroke-ready unit. This integrated approach alone can shave off precious minutes, often between 20 and 40, which are frequently the decisive factor in determining whether an individual achieves a full recovery or is left with lifelong disabilities. When you make the emergency call, it is absolutely crucial to note the exact time the symptoms began. Take out your phone, check the clock, and record this precise moment. This piece of information is, in fact, more vital than any other detail you can provide to the medical professionals. Allow me to share a poignant real-life account. Carlos, a healthy 52-year-old engineer who maintained a rigorous running regimen 3 times a week, was enjoying his morning coffee with his 19-year-old daughter one Saturday. Suddenly, he dropped his cup. Initially, his daughter attributed the incident to clumsiness. However, she soon noticed a distinct alteration in his facial expression. Her mind immediately flashed back to a video she had watched mere weeks prior, detailing the FAST acronym. She calmly asked her father to smile. One side of his face remained immobile. She then requested him to raise his arms. His right arm immediately sagged. When she asked him to repeat a sentence, the words simply wouldn't form. Without hesitation, she grabbed her phone and contacted emergency services, clearly stating, "My father is having a stroke. Symptoms started 2 minutes ago." She meticulously noted the exact time. The ambulance arrived within moments, and the specialized stroke team was mobilized and prepared even before their arrival at the hospital. The entire process, from the onset of symptoms to the administration of treatment, spanned less than an hour. Today, Carlos has achieved a remarkable near-complete recovery. He walks, he speaks, he is back at work. His neurologist imparted a profound observation to his daughter. "Had you waited even 30 minutes longer, your father would likely be paralyzed. You saved his life." This courageous daughter later conveyed her gratitude to me, stating, "I am not a doctor. I simply remembered the 4 letters, FAST. And now I pose a question for you to contemplate with utmost seriousness. If someone you deeply care about were to experience a stroke tomorrow, would you possess the knowledge of what immediate actions to take?" While the FAST test is remarkably effective in identifying the majority of strokes, it is crucial to acknowledge that it does not detect all of them. This is precisely where far too many lives are tragically lost. There exist additional warning signs that are often misconstrued as minor ailments, and this misinterpretation carries an immeasurable cost. It is imperative that you commit these signs to memory with the same clarity and urgency, for some of the most perilous strokes do not initially present with dramatic outward manifestations. The first insidious warning sign is a sudden, explosive headache. This is not your typical headache, not the discomfort of tension, nor the throbbing of a migraine. It is often described with chilling accuracy as the most excruciating headache of one's entire life. It erupts within seconds, akin to a thunderclap, as if an internal explosion has occurred within the skull. This symptom can be a powerful indicator of a hemorrhagic stroke, where a blood vessel within the brain has ruptured and is actively bleeding. This is an absolute medical emergency, demanding an immediate call to 911. Every single second in this scenario is of critical importance. The second telltale sign is a sudden loss of vision or a disturbance in your visual field. One eye may suddenly go dark, your vision might become blurred, or you may experience double vision without any discernible cause. These visual anomalies suggest that the stroke is impinging upon the optic nerve or the visual processing areas of the brain. The third sign manifests as severe dizziness accompanied by a profound loss of balance. This is not a mild feeling of lightheadedness. Instead, the room may appear to be spinning violently, and the individual may be unable to walk in a straight line or even stand without the imminent risk of falling. This constellation of symptoms often points to a stroke occurring in the cerebellum, the region of the brain primarily responsible for regulating balance and coordinating movement. The fourth critical indicator is sudden confusion. The individual may become disoriented, losing track of their whereabouts, the current date, or even the identities of the people around them. In older adults, these changes are sometimes mistakenly attributed to dementia or simply the natural effects of aging. However, if these cognitive shifts appear abruptly, developing within minutes or hours, they may very well signify a stroke. The fifth warning sign is the onset of numbness or tingling on one side of the body. An arm, a leg, or an entire half of the body may suddenly feel disconnected, heavy, or completely devoid of sensation. The sixth sign is a difficulty in swallowing. The individual may find themselves suddenly unable to swallow their saliva, or they may choke easily when attempting to ingest even liquids. This symptom can signal a stroke affecting the brainstem, one of the most vulnerable and critical areas of the brain. The seventh sign is sudden nausea and vomiting that occurs without any apparent cause, such as food poisoning or illness, particularly when it is accompanied by any of the other aforementioned symptoms. Now, pay very close attention because the information I am about to share is responsible for more preventable stroke-related tragedies than almost any other factor. Sometimes stroke symptoms will appear and then, alarmingly, disappear. An arm that was weak may regain its strength. Speech that was garbled may return to normal. Vision that was blurred may clear. In such instances, the affected individual may rationalize the experience as something peculiar but ultimately insignificant, believing they are now fine. This is a fundamentally dangerous and potentially fatal mistake. What may have just occurred could have been a transient ischemic attack, or TIA, often colloquially referred to as a mini-stroke. This is not a benign event. Rather, it is your brain sending a final, desperate warning, a profound cry for help. A staggering 40% of individuals who experience a TIA and choose to ignore it will subsequently suffer a major, permanent stroke within the ensuing 3 months. 40%. I personally treated a gentleman named Roberto who was 68 years old. One Sunday afternoon, his right arm suddenly lost all responsiveness. Within 5 minutes, however, function returned, and the limb was once again normal. He confided in no one about this unsettling episode. 2 weeks later, he experienced a massive stroke, resulting in permanent paralysis. His neurologist, with evident distress, informed him that the initial episode had been his warning sign. Had he sought medical attention that day, the devastating outcome could have been averted. If symptoms appear, even if they are fleeting, it is imperative to proceed to the nearest emergency room immediately. Do not delay. Do not dismiss it as something that will resolve with sleep. Do not assume it was merely an insignificant occurrence. Now I will provide you with the precise emergency protocol that should be ingrained as an automatic response. If you witness someone experiencing a stroke, at minute 0 to 15 seconds, perform the FAST assessment. Check the face for drooping, ask about arms for weakness or drifting, and assess speech for slurring or incoherence. Even a single positive sign is sufficient to warrant further action. At minute 15 to 60 seconds, call 911. Clearly articulate, this person is experiencing a stroke. The symptoms began at precisely, state the time. We are located at, provide your exact address. It is absolutely critical to write down the exact time the symptoms began. While awaiting the ambulance, gently lay the person down, elevating their head slightly to a 15-30-degree angle. Loosen any tight clothing. If they vomit, carefully turn them onto their side. Speak calmly and offer reassurance. Absolutely do not administer food, water, or any medication. Furthermore, under no circumstances should you attempt to drive them to the hospital yourself. Now, I will impart what is arguably the most powerful and life-altering truth of all. Approximately 80% of strokes are entirely preventable. They should never happen. The most significant adversary, the number one enemy, is high blood pressure. Uncontrolled hypertension is responsible for nearly half of all strokes. An ideal blood pressure reading should consistently remain below 120/80 mmHg. It is never advisable to discontinue prescribed medication simply because you feel well. High blood pressure is a silent, insidious, and potentially deadly condition. The second formidable enemy is diabetes. Persistently elevated blood sugar levels inflict damage upon the delicate arteries of the brain. It is essential to maintain your HbA1c level below 7%. The third enemy lurking in the shadows is high cholesterol, particularly the LDL, low-density lipoprotein fraction. This type of cholesterol contributes to the formation of plaque within the brain's arteries. a process analogous to the rusting of pipes, gradually narrowing and obstructing the vital flow of blood. The fourth formidable adversary is smoking. Engaging in smoking triples an individual's risk of experiencing a stroke. However, the good news is that within 2 years of quitting, this elevated risk drops by a remarkable 50%. Allow me to tell you about Teresa, a 65-year-old woman who unfortunately possessed a confluence of all major stroke risk factors: high blood pressure, diabetes, elevated cholesterol, obesity, and a history of smoking. Her physician delivered a stark warning, stating bluntly, "You are mere months away from suffering a major stroke." Faced with this dire prognosis, Teresa made a resolute decision to transform her lifestyle. She quit smoking, commenced daily walks, and diligently adhered to her prescribed medications. 1 year later, her stroke risk plummeted from an alarming 45% to a significantly reduced 8%. She later shared her profound realization with me, expressing, "I genuinely believed it was too late for me at my age. I was mistaken. It is never too late." Now, here is a clear, actionable plan that you must implement without delay. Firstly, dedicate this upcoming weekend to training your family. Teach them the FAST protocol, practice it together, making it an automatic response, a reflex action in times of crisis. Secondly, create a comprehensive medical information card. This card should include your full name, any pre-existing medical conditions, current medications, known allergies, and crucial emergency contact details. Keep this card in your wallet and also place a copy by your bedside. Thirdly, prominently display fast reminder signs throughout your home. Consider placing them on your refrigerator, in the bathroom, and in your bedroom, locations that are frequently visited. Fourthly, set up emergency medical information on your mobile phone. Modern smartphones allow paramedics to access this vital data even when the device is locked, a critical advantage in emergency situations. Fifthly, conduct a mock emergency drill every 6 months. Practice both the recognition of stroke symptoms and the simulated act of calling emergency services. Families who proactively engage in such drills have demonstrably saved lives. I have personally witnessed the profound impact of this preparedness. When we commenced this video, a person somewhere in the world was irrevocably losing their ability to speak. In the time you have spent watching this, dozens more individuals have suffered strokes. Some of them received timely medical intervention, others did not. The crucial difference was not a matter of luck or chance. It was, unequivocally, the possession of knowledge. You now possess that knowledge. 4 letters, FAST, a 3-hour window, and the understanding that 80% of strokes are preventable. The responsibility to utilize this information now rests with you. Please consider liking this video to enhance its reach and ensure more people can access this potentially life-saving information. Subscribe to our channel to stay informed and further safeguard your family's well-being. Share this video urgently with your network and leave a comment below to declare, "I am prepared. I am Dr. Charles Bennett. Protect your brain. Act fast."